Hey everyone, thought we would talk about the drug therapy in heart failure. I think it's a really important area for you to understand. I thought I'd just start with one category because there's obviously a lot to cover, and pretty much depending on where you are in the world, you should have access to this type of medication for heart failure. So there's a group of medications called ACE inhibitors. It stands for Angiotensin converting enzyme inhibitor. And what that is a heart medication which counteracts that particular enzyme in the body, in what we call the neuroendocrine system. And what that does is modifies the, biochemical, hormonal responses in the body to what's happening in the heart. These ACE inhibitors are known to reduce blood pressure. There are lots and lots of ACE inhibitors. They've been around for a number of decades now, and they've been widely used in high blood pressure, heart disease, heart attacks, and of course, heart failure. They were somewhat famous, if you like, for changing the landscape of heart failure management back in the day, because they had a profound effect on mortality. Heart failure years ago was something that, doctors used to sort of tell someone they had heart failure and then, just kind of hold their hand and give them oxygen and some diuretics, some fluid tablets, maybe some nitrate if they could tolerate it, and there were very, very old drugs for blood pressure called hydralazine, and hydralazine and nitrate was a common combination, and we used to just give that to people. It didn't change mortality at all. It really just helped a bit with symptoms, and hold their hands and say, hey, you're going to die, and we'll be there with you, try and make you comfortable. And it's obviously not a very good situation for a lot of people. Heart failure especially is escalating across the globe. And, there are more than 26 million patients in just the Western world alone who have heart failure, and that's probably under-recognised and underdiagnosed. And this is becoming an epidemic, a true epidemic. So ACE inhibitors were something that were the first group of or class of medications proven to change the death rates in heart failure. So a critical step forward, and they've now been around, as I said, for a number of decades. So this is kind of the cornerstone of the first type of medication that would be brought in to manage a patient with heart failure. And these drugs are ostensibly cheap, widely available, and administered carefully, especially if you have lowish blood pressure. So just sort of as you tolerate it without getting too low in the blood pressure. These can be life-altering medications. So this would be, the first of an important set of drugs. Let me also say that heart failure medications are a little different in the sense of treating patients. It's a bit different to, say, a cholesterol medication or some other blood pressure medication where we have a known easy target like blood pressure or a cholesterol level, and we say to you, right, we'll give you this amount of medication, and depending on that response of that medication to achieve the target, which is lowered blood pressure or lowered cholesterol, then once we hit that point and we're satisfied and we're happy, we just go, right, okay, that's enough. We don't need to give you any more. Job's done. Heart failure is a little different. Here's why. In heart failure treatment, we don't have those definable, measurable points. We do have things like how you feel, but let me be clear, an ACE inhibitor isn't going to necessarily make you feel better. it is going to potentially lower your risk of dying and change the outcome of your heart failure, but it isn't going to make a difference to how you feel, with the exception that if it's too strong and it lowers your blood pressure, it can actually make you feel rubbish. So no upside in terms of how you feel, definite upside in terms of your potential for survival. So again, we're not targeting to how you feel. We also aren't targeting to a blood pressure. We might drop the dose if the blood pressure is too low, or we have a greater potential to increase the dose if the blood pressure is high. But what we do want to do is get you on the maximal tolerated dose that you can possibly have. So upscaling or up titrating the ACE inhibitor to its full dose is quite important. Why? Because studies have shown us that in this instance, the higher the dose tolerated, the better the results. And we know from a lot of other studies that medications in general in heart failure are perhaps underutilized, perhaps underdosed, or perhaps just poorly tolerated. And this then affects the potential results that we might be able to get from those drugs. So it's very important that you're not only on the drug, but that it is titrated up to its maximum tolerated dose. This correlates with the highest level of survival. So if we're out to try and have you survive heart failure and hopefully at some point feel as well as possible and do whatever you want to do in life, then that's one of the potential steps. So I hope that's making sense. What are ACE inhibitors? There are lots and lots of names, and depending on where you are in the world, they'll have different names. So you can look those up online. If you have one and you think it might be, you can ask your doctor. You can check it out, look up the drug itself, but certainly ask those questions of your doctors and make sure if you're not on one that you understand why you're not on one, because I think that's an important starting point. And no question is a stupid question. So, I really advocate that you understand your treatment, you understand your medications, you understand how to take them and why you're taking them. And so, I'm here to help you learn that stuff, help you understand what it is that's happening and why we would, as cardiologists and heart failure specialists, why we would choose the types of drugs we are and why we will keep pushing the levels up. If you have queries about that or there's more you want to learn about that, then maybe drop me a line and I can see if I can help with some more videos. But on the next video, we'll talk about another group of heart failure medications that are very important and probably the second most pivotal drugs to come around in the history of heart failure, which are special beta blocker heart failure medications. Not all beta blockers, but the ones that have actually been shown to benefit patients with heart failure. So that's what we'll deal with next, and I will see you then.